Hello, everyone. It's Thursday, December the 30th. Only got a couple days left in this year, and then we're on to 2022. So today, before I leave, I surely want to wish you a happy New Year, and I know we've been through some tough stuff, and 2021 is probably going to continue to be tough, and we got to be on our toes and just watch what we do. But more than anything, we've lost 5,336 great West Virginians, and I ask in every way for your prayers for all these people, all their families, all their loved ones, and everything. It's been some tough stuff. The 5,288th death in West Virginia is a 67-year-old female from Marshall County. The 5,289th death is a 66-year-old female from Hampshire County. The 5,290th death is a 76-year-old female from Kanawha County. The 5,291st death is a 77-year-old male from Monongahela County. The 5,292nd death is a 64-year-old male from Harrison County. The 5,293rd death, an 80-year-old male from Greenbrier County. The 5,294th death, a 75-year-old male from Raleigh County. The 5,295th death is a 93-year-old male from Raleigh County. The 5,296th death, a 46-year-old male from Barber County. The 5,297th death, a 77-year-old female from Hardy County. The 5,298th death, a 79-year-old male from Harrison County. The 5,299th death, a 61-year-old male from Fayette County. The 5,300th death, a 61-year-old female from Kanawha County. The 5,301st death, a 71-year-old female from Cabell County. The 5,302nd death, an 84-year-old male from Tucker County. The 5,303rd death, an 83-year-old female from Kanawha County. The 5,304th death, a 72-year-old female from Monongahela County. The 5,305th death, a 76-year-old female from Clay County. The 5,306th death, a 62-year-old male from Jackson County. The 5,307th death, a 67-year-old female from Putnam County. The 5,308th death, a 73-year-old male from Berkeley County. The 5,309th death, an 80-year-old male from Raleigh County. The 5,310th death, an 89-year-old male from Mercer County. The 5,311th death, a 90-year-old male from Raleigh County. The 5,312th death, a 22-year-old male from Lincoln County. Gosh, goodness. The 5,313th death, a 68-year-old male from Raleigh County. I want to step back. A 5,312th death, a 22-year-old male from Lincoln County. The 5,313th death, a 68-year-old male from Raleigh County. The 5,314th death, a 65-year-old male from Mercer County. The 5,315th death, a 67-year-old male from Mercer County. Oh gosh, I keep messing this up. I'm sorry. I'm really sorry. The 5,314th death, a 65-year-old male from Berkeley County. The 5,315th death, a 67-year-old male from Mercer County. The 5,316th death, an 85-year-old female from Berkeley County. The 5,317th death, a 53-year-old female from Berkeley County. The 5,318th death, a 61-year-old male from Raleigh County. The 5,319th death, a 63-year-old male from Summers County. The 5,320th death, a 61-year-old female from Raleigh County. The 5,321st death, a 60-year-old male from Mercer County. The 5,322nd death, a 60-year-old male from Mason County. The 5,323rd death, a 66-year-old female from Mineral County. The 5,324th death, a 79-year-old female from Kanawha County. The 5,325th death, a 50-year-old male from Mercer County. The 5,326th death, an 84-year-old male from Hampshire County. The 5,327th death, a 57-year-old female from Berkeley County. The 5,328th death of 55-year-old male from Mineral County. The 5,329th death of 53-year-old male from Hampshire County. The 5,330th death of 59-year-old female from Mason County. The 5,331st death of 77-year-old female from Mercer County. The 5,332nd death of an 83-year-old male from Mason County. The 5,333rd death of 68-year-old female from Taylor County. The 5,334th death of 42-year-old female from Kanawha County. The 5,335th death of an 82-year-old male from Wood County. The 5,336th death in West Virginia is an 82-year-old female from Wirt County. And again, I apologize for sputtering and everything, but you know, when you think a 22-year-old person that we lost, that's really not good. Really, really sad. We have 11,017 active cases in West Virginia right now. Get this number. We have 2,648 new cases, 2,648 new cases in West Virginia. Daily positivity rate at 13.77, cumulative rate at 6.48. We have 311,809 people that have recovered. We have 646 people hospitalized, 197 in the ICU units, and 108 on the ventilators. We have 30 red counties in West Virginia right now. The Omicron virus is moving across our state. We still really only have 18 cases, but it is absolutely moving, and we know it's moving. It's going to get tougher. There's 22 county outbreaks and 22 school outbreaks in 15 counties, 217 confirmed cases. Before I go any further, I want to recognize a great lady that we lost, one of our senators, Sue Klein. Many times we lose individuals, and I ask for your prayers and everything. Sue was not only a great senator, but a friend. I knew Sue Klein really well. I know how she championed all kinds of things in the southern coal fields and how fiercely loyal she was to the great people of Wyoming County. And Kathy and I are sure going to, pass our condolences and mourn her death. But she was a great lady. I'll be issuing a proclamation to lower our flags and the U.S. flags in West Virginia, when we know a little bit more about when the services are set for passing on honor and everything to her. But nevertheless, keep her in your prayers. She gave an awful lot. A beautiful lady that was really passionate about all the folks, where she grew up or she was all the time. But please remember in your prayers. More and more stuff is going on. I've directed my team to closely monitor our numbers and provide me with recommendations about our hospitals and our critical care infrastructure. The bottom line of the whole thing is save lives and protect our hospitals and protect our ability to care for our people. It is absolutely essential, and we're very concerned, very, very concerned about the possibility that we could get into a situation where our hospitals are overrun. I remind everybody again about 65 and older, if you have any conditions and you have any concerns whatsoever, get tested. Get tested. I had another individual that I was around, close with in the last couple of days and everything. He just tested positive and everything. He's a very, very dear friend and everything. We just found out about it. I just got tested again myself. Absolutely, without any question, don't mess around with this. If you have a reason to be anxious or you're not feeling well or whatever it may be, and I feel great, but if you have any reason whatsoever, utilize the fact that you can get tested. Absolutely, you need to get tested quickly. If you're 65 and older and you have any compromising issues, get tested. these antibodies that we have will save your life if you would happen to be test positive. And I encourage you over and over, if you're 65 and older with compromising issues and everything, you're going into a crowd of people that you don't know, wear a mask. It's no big deal. Just wear a mask. From a standpoint of your booster shots, I would say to you that you're absolutely not thinking well. If you're fully vaccinated, you've got 2 shots of Moderna, 2 shots of Pfizer, or 1 shot of J&J, and you're not taking your booster shot, you're just not thinking well. That's just all there is to it. I am super respectful to everybody's rights, and I'm going to stay that. I'm not going to waver on that whatsoever. But at the same time, if you stepped up and got yourself vaccinated, for crying out loud, you got to get that booster shot. From a standpoint of our numbers, they haven't changed much. Again, all those 18 and over that have had 1 shot, that's 71.2%, 83.4 on the 50 and older, and 91.1 on the 65 and older. I encourage your young people to take this vaccine. I encourage their parents and grandparents to help them get across the finish line and get vaccinated. Really, really, really important. Absolutely. We don't want these lingering side effects that are possible for our young people, and we want to protect them. All the information on the COVID line is up there. All the stuff about free testing, all of that. We continue to thank Frith and Walgreens for all this great stuff that they did. We have 61 outbreaks. That's up a little bit in our long-term care facilities. We have an outbreak now in a church in our church community in Monroe County. We have 44 inmates and 51 staff people that have this in corrections, and that's pretty daggum good. And we're going to continue to work it just as hard as we possibly can. I want to remind you about taking your flu shot. You can get that at the same time as you get vaccinated with your COVID shot. There's no problem getting both at the same time. I want to remind the people, the renters and the landlords, absolutely, there's still real money here, and we would be foolish to not take advantage of that. Call us and see if we can get you qualified. I remind you about giving blood. I go over and over the same things, but really and truly, here's all there is to it. Especially if you have had the gift from God above to survive this pandemic, you should definitely consider giving blood. It just seems to be something that you ought to at least consider if you've been blessed with that incredible gift to survive through this. I've declared a state of preparedness in all 55 counties due to the threat of flooding from additional rainfall this weekend. We just got to watch that, and I've directed our State Emergency Operations Center, and they're coordinating with everybody, and all these people from the Emergency Management Division will coordinate with all the county local people and everything, and they do great work and everything, but we just got to stay on our toes right there. We do live in these mountains. They are steep. And when we get rainfall, especially at this time of year and whatever like that, where the ground's getting halfway saturated and everything, we can get into a situation where we have this flooding and we're going to have to just deal with it. But nevertheless, be safe and be careful. Last thing I've got is just this, is what I'll let off with is tell you that tomorrow is New Year's Eve. We're going to start 2022, and 2022 is going to be better than 2021 in every way. There's lots and lots of good happening in 2021, but we're just going to make it better, and we're just going to keep on making it better. 2023 is going to be better than 2022, and as we go forward, that's what we got, the way we want to look at everything, and that's exactly what we want, how we want to approach the great stuff that's going on in West Virginia. So Kathy and I wish you a Happy New Year, that's for sure. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. In support and reinforcement of what the governor said, we have seen now the most highest transmission week in our history during the COVID pandemic, this past week from the spread of COVID-19. And we averaged about 301,000 cases a day. Note that during the Delta surge of COVID-19, our highest single day total was 303,000. And so as we start to look at the spread of COVID-19 with the Omicron variant, we can see that this is a different type of virus than we've seen before. And as the governor said very clearly, it is so important for our citizens to be fully vaccinated and, if eligible, to get a booster. We know that the Food and Drug Administration is looking to allow vaccine boosters in younger children, age 5 to 12, and to reduce the time frame for all people to get vaccines from 6 months to 5 months because of emerging data that is being seen that demonstrates that that all vaccines after that sort of 4 to 6 month window start to lose potency and protection against the spread of COVID-19 with the Omicron variant, and also start to lose some protection against people who may be at risk for hospitalization or even death. We have also seen that in our lowest vaccinated part of our population, our children, that there has been about a 58% increase in hospitalizations over the last week to 2 weeks in hospitals around the country. And although hospital numbers are up in the order of 15% across the country, in many states, they are hundreds of percent times their last week or 2 week ago numbers. And several states, including Maryland and New York and others, are seeing hospital numbers as high as they've ever seen them before. So as we look at the Omicron variant and particularly start to look at this spread, yesterday we had 489,000 new cases of COVID-19 in the US. We know that there is a really important link between the level of illness people can get with all forms of COVID-19, and including the Omicron variant, and your vaccination and booster status. And so it's really, really important as we go into the new year with the amount of rapid spread that we are seeing around the country that people be very, very careful. The updated numbers that we just got immediately from our in-state sequencing lab would suggest that last week when we ran the positive cases of COVID-19, we saw about a 3% incidence of the Omicron variant. This last week's run, we now are up to 15% of the total number of samples run. So we are running about 3 weeks or so behind the nation, where the nation saw the number of Omicron variants as far as the new cases go from 3%, then to 13%, then to 58 to 74%, depending on where the data feed is. But suffice it to say, over 3 weeks, Omicron became the dominant variant. We have gone from 3% now to 15% this last week, and we anticipate in the next week or two, Omicron will also be the dominant variant in West Virginia. So this is a much more highly contagious form of COVID-19, can infect people who are vaccinated and are boosted, but the vaccination and booster status does protect people from the severe consequences of COVID-19, including the Omicron variant. So we are getting ready to see the storm come to West Virginia as it's come to many other states. And as the governor said, the key for us is to protect hospital function and capacity and protect lives. You've seen, and we talked about, the CDC has changed the guidelines for quarantining and isolation. And that's particularly important for people that are fully vaccinated and boosted, that it's gone from 10 days to 5 days. But it's really important that people pay a lot of attention and be very careful during this celebration time, because this variant spreads like measles, which means it spreads faster than any other respiratory virus that we've seen really in our lifetime. Thank you very much.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just to highlight a couple of key items. Testing. We still have 183 steady state testing sites across our 55 counties. If you have issues with identifying where those are, you can call the 1-833-734-0965 number. And the same folks that help you with identifying vaccine locations can help you with testing locations. Jordan just put the map and the number up. You can also go on the DHHR website and pull the information up and put information in about your location and to get sites there. As the governor pointed out, our hospital numbers continue to increase. Important number for us, again, to pay attention to is the number of new admissions. 85 for today, 95 yesterday. That's 25 and 35 above that break number that we look at of 60 that really has a significant impact. So again, continue to encourage everyone to be tested when you feel like you have a potential symptom. And as the governor's pointed out before, this is not about us individually. This is about us protecting others. So while I might get symptoms and get tested and have minimal impact, what if someone close to me and I didn't know who has other underlying health conditions would then get it? And that would lead to potential significant health problems for that individual and potentially hospitalization and maybe even worse. So again, it's about protecting others, not just about ourselves. Antibodies and antivirals, as I mentioned before, we'll continue to mention there are continued national supply chain challenges with antibodies and antivirals. And then there are also challenges with the efficacy of those as it relates to Omicron. So as Dr. Marsh pointed out, we went from 3% to 15%. You would think next week we would potentially be at 45%. And then beyond, we've got to understand that the best thing we have available to us as West Virginians is that preventative piece, that preventative treatment, which is vaccinations. And we need to continue to ramp up both vaccinations in general as well as boosters, particularly for our 50 and older population. Last couple of things I'll leave you with is the governor continues to press us as a task force to look at ways to better help and be prepared going forward. One of the things that we've done most recently with the Red Cross is the Red Cross was having challenging with transportation of blood supplies. So we're working to train some individuals to augment their blood supply transportation staff, which helps relieve pressure for those who do the phlebotomy work to make blood supplies better available. We will also be presenting information in the future based on some additional training that we will do for staff to make sure we have additional support as surges come in our hospitals. So again, preventive treatment vaccine is the best opportunity that we have right now. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. Tomorrow's New Year's Eve, and I do want to wish everyone a happy new year. And just to remind everyone that if you plan on celebrating with your family and friends, that it would be a good idea if you're able to get tested. General Hoyer did mention we have multiple testing sites available. Also, if you're not feeling well, to maybe not join the event if possible, and to just be safe out there for the upcoming new year. Thank you.
Thank you, Doctor. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Todd Boucher with WTAP.
Well, thank you very much, and good afternoon, everyone, if you can hear me. I think one of the reasons that I was signed into this call is that this is my next to last day at the TV station here. I am retiring as of the end of the year. But I will get to a question here. And then yesterday I was listening to a press conference in Ohio, which I often refer to as that state across the river that I was born in. And the director of the Department of Health there had an interesting comment. He said, while COVID is something that we'll have to learn to live with in the future, he also added something of an optimistic note. He said he doesn't think that we're anticipating that we'll continue to live in the situation they've had to endure in the last 2 years, in the early years of the pandemic. I'd like to hear from the health team as to whether they feel the same way.
Well, Todd, let me lead off. This is the governor. Todd, you've been in Parkersburg at WTAP for a long time, 41 years. And I've seen you way, 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 way before I could have ever even thought any thought whatsoever about running for governor. You know, you've done great work. We'll miss you. You're a really familiar face, and we'll miss you. So I congratulate you in your retirement. I wish you the very, very best. I hope and pray that it's just absolutely great beyond belief, and but we'll miss you. And your contribution is surely duly noted. But I'll let my health team answer your question, and again, I thank you. You know, you've been a family, familiar face to all of us, and so, you know, God bless, and just keep doing good stuff in life, and enjoy your retirement. But nevertheless, if our health team, maybe Dr. Amjad, or maybe you could lead off, or Dr. Marsh or whomever.
Okay, I'll just start, Governor. Thanks. Todd, thanks for the question and congratulations on your retirement. I would agree with that statement. You know, COVID-19 is going to be around and we need to learn to adjust to it, but we also have to take advantage of everything we have that can keep us safe, vaccines being the number one. We have other treatments, you know, monoclonal antibodies, oral antivirals coming out, but we still know that the vaccine is offering the best protection to keep people out of the hospital and from dying. So while we do need to learn to live with it, we also have to follow what's going on up to date now and do what we need to do to keep ourselves safe. But Clay.
Thank you, Ein, and thank you for your service, Todd. No, I think that that's exactly right. You know, we have seen the COVID virus mutate and create these new variants that have had increasing capabilities to infect. So this virus certainly wants to keep infecting us, and it is really up to us to become more fit to deal with the virus. And the fitness comes, as Dr. Amjad said, from full vaccination and boosting, but also from being really smart and particularly being careful about who you're around this holiday season, wearing higher quality masks. You can get N95 or KN95 masks that are approved by NIOSH, the National Institutes of Occupational Safety and Health. You can get them off Amazon and other places. Wearing a high quality, high barrier protection face mask is really important. And using testing, as the governor said, to make sure that if you do get exposed to somebody, that you're following your own course. And if you're at risk, if you're older or have other medical conditions, then making sure that you're connected with your doctor as well, so that if you do test positive, we can quickly start to look at interventions that may protect you from getting severely ill or dying. But we are going to need to learn to live and are learning to live with COVID. And we hope it will go from pandemic to perhaps epidemic to endemic, which, you know, means it goes like the flu and other respiratory viruses over time. But that is really quite dependent on our ability to get fit enough to allow that to happen. Thank you.
Thanks, Todd, and happy retirement. We'll now go to Paul Mullen with WCBC.
Once again, congratulations, Todd. Happy retirement. Good afternoon, everyone. Governor and perhaps Major General Hoyer, I'd like to know a little bit more about how you are monitoring the hospital situation. I know some rural hospitals get into diversion from ER and those kind of things. And there are people out there that are staying away from the hospital because they don't think they're quite bad enough to get that level of care, but then they find themselves in trouble. And maybe the medical personnel can chime in on this. Is there a sweet spot where you absolutely got to get to the hospital? Is it always triggered by respiratory symptoms? If you could give us an update on that, thank you very much.
Well, Paul, I'm going to pass in just a second to General Hoyer and everything, but I can promise you this, Paul. We're getting updates from everybody nonstop, as far as the hospitals and everything. It's gone on. It just keeps going on and on. But nevertheless, General, maybe you can step in and add a whole lot more to this, maybe Clay as well.
Yes, sir, Governor. So, Paul, as the governor pointed out, we look at these numbers with all the hospitals through the Hospital Association daily. We look at everything from, as you've heard us talk about before, total COVID cases, ICU COVID cases, ventilator COVID cases, as well as total new intakes. But we also look at each hospital's ICU capacity, as well as bed capacity. And as you know, those numbers can now be driven not just by the number of available beds, but the available beds that can be staffed. So a lot of things looked at daily. And I will turn it over to Dr. Marsh to give advice and guidance on when to go beyond primary care.
Yes, thank you, Paul, and thank you, Governor and Jim. So we would very much recommend for all West Virginians who may test positive to make sure that you call your primary care physician or your healthcare provider. They are in the best position to give you more precise advice about whether you need to come to the emergency room or to the hospital. We know that we are anticipating seeing an absolute huge numbers of new cases of COVID-19 as we track the rest of the country. And obviously, we don't have the capacity for everyone to come to the emergency room. So it is really important that we help provide the care and the oversight and the help and the assurance for all people who might be positive for COVID to try to allow them to stay in their homes and get the very best treatment that they need and the appropriate level of care that they need in a very consistent way. And so please contact your primary care physician, your healthcare team. If you do have questions, we still have a hotline and we can refer you if you don't have a primary care provider to be able to get the resources you need. But we are very much wanting people to stay at home unless you absolutely, you feel short of breath, if you're having trouble, having chest discomfort, et cetera, and you're worried that things are really progressing, or particularly if you're older, over 50 and over 65, and or have other, severe, significant health problems, please contact your physician so that they can help you work through that issue in the most beneficial way for your health. Thank you.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone, and I would like to send my happy retirement wishes to Todd, and also extend the good wishes of my co-anchor, Amanda Barron. She thinks the world of you, Todd, and so best of luck to you. My question is probably best addressed to the medical. There we go. The medical team. Because the CDC has issued some new guidelines that are causing some controversy, basically saying in some instances, hospital employees who have tested positive with COVID could or should go back to work if they're asymptomatic. And I'm wondering if our medical team here has any concerns about hospital workers being mandated to go back to work, even though they've tested positive for COVID. I realize there's a staffing crisis across this state and across the country in our hospitals. And do you think this will help?
Dr. Marsh, this is you, sir.
Thank you, Mark, and thank you, Governor. Certainly, Mark, Dr. Rochelle Walensky, who is the director of the Centers for Disease Control, has come out and gone over the motivation behind these new guidelines. As we look at the Omicron variant, when looked at across many studies, tends to infect people faster within the first 2 to 4 days. Appears to be the most predictable time when people will test positive after an exposure. Certainly it can be 5 to 7 days like Delta variant was as well in some people, but ultimately because the Omicron variant seems to spread faster, the CDC decided that it was reasonable to reduce the isolation time for people who tested positive, who are fully vaccinated and boosted, or people who are exposed to people with COVID-19 closely, to 5 days instead of 10 days. And that allows not only the more rapid re-entry back into the population for people, and the idea is at 5 days, if you're positive, you have 5 days, then if you're fully vaccinated within 6 months of your last Pfizer or Moderna vaccine, or if you're boosted after 5 days, if you're not having fever or other symptoms, you can don a high quality face mask and be back into the circulation for the residual, 5 day addition to get to the total of 10 days. I think when it comes to healthcare capacity, as General Hoyer just mentioned, we are particularly concerned about about surging at our hospital system level. And part of that surging is really dictated by available staff. And we know that staffing is the biggest challenge we have right now to hospital capacity. So looking at working with hospital leadership and infectious disease leadership that is local at hospitals, the CDC has indicated that under crisis standards of care, under really extraordinary circumstances where staffing is really, really short, then people can come back to work even without doing the 5-day isolation if they are asymptomatic, wearing a high barrier protection face mask and N95 face mask in general. And then it will be up to the hospital leadership and infectious disease leadership to dictate how those workers are going to be utilized to take care of patients. And the presumption would be that there would likely be a match between those people that might be positive for COVID testing but asymptomatic, wearing high barrier protection face masks, and perhaps taking care of people that are also COVID positive. So there needs to be a lot of thought and care about if you do have to go to that extraordinary measure. But generally, the CDC guidelines have really reduced the isolation time and any quarantine time from 10 days to 5 days. And that is going to make it easier for us to get people back into the workforce, but also to liberate people who are asymptomatic with this new form of COVID-19 that comes on faster. And the presumption is from the CDC that the spread will also be in a shorter time frame. So by that 5 days after you are first positive or you've been exposed to somebody, that you should not really be infectious to nearly the same level, and that you'll be wearing a high barrier protection face mask during that latter 5 days of the isolation or the quarantine. Thank you.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to direct my question to Dr. Marsh, and this kind of goes along with what you were just talking about. Could you talk a little bit about the way the symptoms of Omicron are presenting itself and compare that to the previous variants we've seen? Are fever, cough, and a loss of taste and smell the kind of main indicators that people still need to be aware of, or is that changing as Omicron comes into play?
Dr. Marsh, please go.
Thank you, Governor, and thank you, Charles. Omicron's a bit different than the previous forms of COVID-19 as far as the most common symptoms. And Omicron really is more like a cold. And it's particularly more like a cold to people that have been vaccinated and boosted, but more scratchy throat, upper airway stuffiness, blowing your nose. Some people might say, oh, I have a head cold. Some people might say, oh, I've got sinuses. So we have to be very, very aware of those symptoms. In a study done immediately, really before Omicron, it was found that up to 40% of people may be relatively asymptomatic even with COVID-19. And that's probably even more true with Omicron. So if you become contacted to somebody who is positive for Omicron, really important that you test yourself, and probably test yourself at day 3, day 5 after exposure if you've been fully vaccinated and boosted, and wear a mask around other people. And if you haven't been vaccinated, or if you're outside of that 6-month window and you haven't been boosted, then you should go ahead and quarantine and test yourself at day 5 to then look to see if you've gotten the infection. If you do develop symptoms at any time during the isolation or quarantine period, you should get tested, and the testing should be done either by a rapid antigen test that recognizes Omicron, and the Abbott test and the Quidel test do both recognize the Omicron variant, the Quick View and the Binax Now. And also, it's really important for people who develop any kind of feeling that you've just got a little cold to go ahead and test for COVID-19. Since the loss of smell and taste don't seem to be nearly as prevalent with this variant.
All right, thank you, Charles. Next, we'll go to Bob Aaron with WCHS and Fox 11.
I'm trying to disconnect.
Bob, I think you're muted.
Happy New Year, Governor, and to the whole team and yourself. Thank you for your sincere efforts over the last year to try and deal with this virus. Looking at today's numbers, which the way I read them indicate the most active new cases that we've ever seen in a day, and what Dr. Marsh just predicted will happen over the next 3 weeks, is it enough to ask West Virginians to just pull the rope when only about 51.3% of us, for various reasons that range from being too young to get the shot to I don't care what I do and how it affects somebody else, is that enough, or do we need to enact some other measures, and shouldn't we do it now since we know what's coming?
Well, Bob, it's a difficult decision, is it not? And really and truly, I think what you're basically you're asking is if we continue to encourage and keep everybody as best we possibly can pulling that rope together and encouraging their families and their friends and whomever it may be to either get vaccinated or get the booster shot, is that the most effective way, or is it the most effective way to start, drawing lines in the sand and saying, well, this is the mandate that what we expect you to do, and then we get a real pushback, and it's a difficult decision. I really believe that I do not believe in mandating people, from the standpoint of their freedoms and everything that we have in life. It's made us what we are. But absolutely, the thing that will motivate more to get across the finish line, I hate to say it, will be either a continued effort from our side to encourage. I've always believed you get a whole lot more with honey than you can going the other way. But with all of that, Bob, the real reality is, if this thing were to break out in even a worse situation than what we have today, and a bunch more people die, you'll have a run on the bank as far as people running to get vaccinated or get their booster shots. we don't want that. We don't want that at all. And it's a fine line and a really, really difficult decision, but I believe we're making real progress. It's hard to argue that, but I wish to goodness that it was better. But I think the best course of business is the way we've been, rather than start drawing lines in the sand and dividing us and having a real tough issue on our hands.
All right, thank you, Bob. Next, we'll go to Travis Lawler with the AP.
Hey, sorry, thank you. I don't have any questions.
All right, thank you. Next, we'll go to Aaron Beck with the Shinston News and Harrison County Journal.
Hi, everybody. And just a note for the audience, I also contract with other organizations, including Think Kids West Virginia and 100 Days in Appalachia. So you may see stories from me there as well. My question is about why you aren't releasing real-time data about child hospitalizations. As Dr. Marsh mentioned, those hospitalizations are increasing nationwide. Governor Justice, you mentioned that you receive nonstop updates direct from the source, which would be the West Virginia Hospital Association. I had heard that you all were receiving daily reports from the West Virginia Hospital Association about adult and child hospitalizations in West Virginia in early October from Dr. Marsh. I requested those under the West Virginia Freedom of Information Act on October 4th. So it's been about 70 days and I still haven't received those public records. I also requested them from DHHR more than a month ago. I believe this data is important because it has more information about child hospitalizations than the CDC is reporting. Things about information about disease severity, like whether or not the kids are requiring intensive care, whether or not there's adequate capacity and staffing. Some are still saying that COVID isn't harmful to kids. So my question is, why are you withholding this information from West Virginians?
Aaron, listen, I'm going to defer, to Dr. Marsh and Secretary Crouch, but let me just say this. And Aaron, whether you buy it or not buy it really doesn't matter to me. I really want everyone to know that there could not possibly be anyone that's wanting to be more transparent than I. And absolutely every single person that's having anything to do with any of this, nobody's withholding any information from anybody. Absolutely, we have been as upfront every single day as we can. And, to the point in time where we have reported things and reported them immediately when they came to our attention, that there were shortfalls in any way, we always reported them. And that's what we're going to continue to do, because I truly believe if the people believe and trust in you and you tell them the truth, absolutely they will pull that rope with us and pull it together. So that's why I'm here all the time. That's why I'm here at every single briefing. And, Aaron, I go way, way back. Now think about this. When we had our very first briefing, I was asked, I said, it was like on a Monday, and I said, we're going to get together with you again on Wednesday, and then we may even get together again on Friday. And one of the first questions were, are you going to be there? Are you going to be there at all the briefings? I've been here every single solitary one of them. And that's exactly what I'm going to continue to do, because it's that important. And with all in me, I want everyone to know that we are completely transparent. There is nobody withholding anything. But to the specifics of your question, maybe we can start with Dr. Marsh, and then we can go to Secretary Crouch. But maybe Secretary Crouch right off the get-go. We'll go with him.
Yes, Governor, thank you. And thank you, Aaron. We do get reports from the Hospital Association daily, Aaron. The information can be difficult to interpret, but it also can be confidential information. We don't get age of the patient in the hospitals. Hospitals, especially smaller hospitals that have small numbers of cases, maybe one or two, could be identified. The governor reads deaths by age for counties. So many counties only have one hospital, if any hospital. So we're very cautious about making sure information that might be confidential is kept confidential. So, and we work with the Hospital Association on that. So the information we publish on the dashboard gives the total number of cases. It gives the numbers in ICU, and it gives the numbers on ventilators. It does not break that down by hospital. But we also, again, don't have as much information as you may think with regard to hospitalization. That information is proprietary information from the Hospital Association. So we do get a report, but it's pretty broad. We're looking at your request now. We are going to try to provide any information that we can that can be made public. So we will get back to you on that. With regard to all of the other information out there, we've been, as the governor said, open and transparent about everything, trying to push out any information that we can out there, including the variants, the numbers of cases by county, vaccinations by county. So the information you're referring to comes through the Hospital Association and is not actually DHHR's information, but we'll continue to be transparent with everything we can.
All right, thank you, Aaron. Next, we'll go to Marley Pinchak with WSAZ.
Good morning. Thank you so much for this opportunity. So we're quickly approaching New Year's Eve, coming right around the corner, and already West Virginia is seeing concerning numbers with COVID-19. A lot of people are going to be traveling out of state, visiting their friends and loved ones. What plans does the state have to make sure we don't have a skyrocketing surge as we enter the new year?
General, please.
Yes, Governor. So again, we can continue to do the things that are available to us in the way of resources, to include, as the governor has laid out, continuing to ask people to get tested, continuing to make sure that we have vaccines available, and what supplies are available nationally in the way of antibodies for those who might get sick. To use effectively what treatments that we do have available based on the national supply chain shortages, as well as looking at manpower. And one of the things that recommended or mentioned today that we're doing is working with the Red Cross to make sure that we provide additional assistance for blood transport. So we continue to look at all the operational things available to us to make sure that we reduce the number of deaths and the number of hospitalizations in the state of West Virginia.
All right, thank you, Marley. Governor, I'll turn it back to you.
Okay, just to recap real quickly, and again, I make notes and listen to all of our experts and everything. One of the things that should catch everybody's eye is there are 183 testing sites that are still available to you out there. If you need to get tested and everything, absolutely. If you have any reason whatsoever to think that you'd like to get a test, 183 places out there that you can get tested. All you got to do is just run in there. It wouldn't take a second and everything, just to double check and everything. If you have any symptoms, any concerns whatsoever, go get tested. We had 85 admissions into the hospitals yesterday and everything. Now, if you'll just stay with that just 1 second. The sweet spot for us is when we go over 60, there's alarm buttons going off. We continue to be over 60. And we may be right on the doorstep of something that could even be worse than that. So we're at 85. 85 is not good. That's not good. I guess I want to end with just this. I want to end with a question, or a statement. I watch these people and I talk to them nonstop all the time. if you got a problem, any problem and everything, you know, I may be on the phone with them at midnight. Absolutely, it doesn't matter if it's a Saturday or Sunday or just like Christmas. I mean, Christmas before last, we did a briefing right here. Without any question, there is no such thing as a holiday or a weekend or it's past hours. You know, these people are available to us and they have been servants to this state beyond belief. Here's my statement or my question. First, my statement is what a team. What a team that's been put together. All the people in the governor's office here, all the people, you know, that are working this over and over and over. But just think about this team. Dr. Clay Marsh. Think about General Jim Hoyer. Think about Dr. Amjad or Secretary Crouch. Think about that team right there. And ask yourself this question. Where would we have been without them? Really and truly, if you'd had the average, everyday, run-of-the-mill, whatever it may be, where would we have been without this team? I can never thank them enough. They absolutely work tirelessly beyond belief, and they are superstars. That's all there is to it. I'm very, very blessed to have them with me. It's been an honor beyond belief. Last two things I'll say is just this. Congratulations again, Todd. You know, Todd has been with us a long, long time. 41 years, he's served us, he's been in our households, he's been everywhere all the time. Without any question, we congratulate him on his retirement and wish him the very, very, very best. And the last of my last is just this. Happy New Year, West Virginia. We're right upon the new year. We've got lots and lots and lots of blessings to be thankful for and lots of prayers that go up to a lot of people that are out there hurting. We've done a lot of good, and we've helped a lot of people, but there's still a lot to do. And we want to stay right at it, and we want to continue to flip every one of those rocks until we've absolutely helped everyone. So with all that, again, I say, Happy New Year, West Virginia.